Well, welcome to our podcast and a conversation about different topics around health equity and activism. Maybe we can just kick this conversation off by inviting you to introduce yourself and talk a little bit about the work that you do, and then I will ask the hard question that we are going to discuss today.
Sure, happy to. Yeah, again, I'm Dan Cabrera. I am working in the Department of Medicine as a hospitalist at the University of Washington in Seattle, Washington, and I work clinically at our safety net hospital, which is Harborview Medical Center. It used to be the old county hospital, if that kind of gives you a feel for the types of patients we care for. And I've been involved in kind of two main areas since being in academic medicine. One is medical education. So I've worked with teaching students and residents and even faculty development, but I also have a big interest in work in equity, diversity, inclusion. And so I've been doing that, gosh, I think probably even before being a faculty member and attending. But currently I hold roles as an assistant program director for our internal medicine residency, focused on issues of equity, diversity, inclusion. And I'm finishing up finally a stint. It's ending as the interim associate chair for equity, diversity, inclusion of our whole Department of Medicine here at University of Washington.
Yeah, well, that's a great segue into the hard question that I mentioned. So, you know that these conversations are meant to inspire and motivate kind of like health activists and people who are pushing for health equity across the country. And I think diversity, equity, and inclusion has been a topic, almost like a buzzword these days, that like a lot of institutions are talking about. But the main question that I want to ask you is like, what is the experience of advocating for that? And what are your main lessons from thinking about like your own experience in working within the institution that maybe didn't have that at the beginning, or trying to explore what it means to actually practice that? What is your experience in doing that? So maybe we can start there and then take it from there.
Sure. Yeah. And keep me on track if I don't get to some of the answers to some of the questions you just asked. But you know, I've been around long enough to know how some of this has evolved. And what I mean by that is that, you know, I remember being an undergrad student and then a medical student, where really the focus was on diversity. It was like, how can we make the field more diverse? And as a Latino man, I got to be part of different diversity initiatives for undergrad and even med school. And so that's where it was started. And that was, gosh, I want to say like 15 years ago now. I've been out of training now for 11 years. But, you know, I got to see that it went from diversity focused to, oh, well, now we have more diverse people, so we should probably make the environment a little better for them. Mm-hmm. Although that wasn't always the focus. And so then they added on the I, which was the inclusion. And then I think it was maybe a generation or two after me, that really started to focus on the issue of equity and what that looks like, with a lens really looking at patients, and having equity issues come up in the institutions that trained future healthcare providers, including physicians. And so now I think it's kind of come to this, like, it was diversity inclusion, and now it's diversity, equity, and inclusion. So it's kind of interesting to have seen that kind of journey over the past 10 to 15 years. The reality is I think that these big institutions, academic institutions, they kind of treat it the same as they did when it was diversity. It was a hot button, you know, it was a thing, and then it had its moment, and then it kind of dies off, and then something happens, and people raise the issue of, well, it's not just about diversity, it's inclusion. And then the institution gets, you know, a little more energized and engaged, and then it kind of dies off. And then now we're on DEI and, you know, and adding things like justice. So it's, you know, JEDI or whatever you want to call it. And then anti-racism. And then it feels like it starts to die off again. Or not die off, but like the energy kind of dissipates from the institution as a whole. And yet the throughput through it all are the people that are really just committed to the work. And the same people that would have been committed to it when it was just quote unquote diversity as it is now, as, you know, diversity, equity, inclusion. So I think what it is that there's needs to be this kind of sustainability piece to it that I think is really hard. And I think it really wears on the people that are really into this work, because the work is important.
Yeah, no, that is really interesting. I love the kind of like a little bit of history and kind of like reality check right now. A lot of people that we talk to, and you were part of the Health Equity Scholars
Yeah.
Program, and like the colleagues that we discuss some of those issues, we'll ask this question: how do we know, like, if I look at an institution, how do we know that we are actually doing it for real versus, like, just as you were saying, like having another campaign, maybe a little bit of excitement, and then, what are the metrics that you are looking at, like just from your own personal experience as an activist and someone who is promoting this and really working obviously for a long period of time? What are the indicators that are showing to you like that there is progress? Like, what do you look for to see the progress?
Yeah, I mean, I think I'll start with what in my experience, the institutions think is progress. They're very much about measurables and data. And so, the first things you'll see is, like, what is the makeup of your, of your faculty and staff and scientists and employees and all that stuff that kind of makes up an academic institution or a department within one of those. And like, how diverse are we, like, and I feel like that kind of, they want to see the numbers, even though it really, you don't need numbers all the time to look around and see that there's not a lot of Black and brown faces on the campus or in the building or in the hospital or whatever it is. But yet our, leaders want the numbers, right? And then if it's not demographics, then they also want data behind, we do these occasional climate surveys. And again, the responses and the results aren't really that surprising, right? The people from underrepresented backgrounds are the ones that are saying that they have the most difficulties with the culture and climate of the institution. But you would have predicted that even before. So we're just kind of doing things, sometimes it feels like, to just, certify or, absolutely confirm what we already have known and is an issue for now over decades. So I think for me, what would look like progress is to, like, yes, we're still going to check our demographics to see how diverse we are. Yes, we're still going to do climate surveys, but I think it's really about, like, moving past that, right? Like, so what else are we going to do? Because I think there's a lot of, money spent on these things to collect this data. And I think the other thing that happens is that we also try to third party everything. And so sometimes, I think that, it's not necessarily driven by results. It's just driven by sometimes an action. Like, for instance, our institution spent thousands of dollars to have a consulting group come in and talk to us about bias reduction. Do I know that reduced bias? I'm not sure. Do I think that there's still bias occurring and people being harmed in the workplace? I think so. And so I think what's hard about this is that there's not going to be some absolute data point that tells me that things are better. But I think making the things, better for others, and that there are more diverse people and that you make them feel heard and that they're part of the fabric of the institution is probably the biggest marker. So to make a long-winded answer much shorter, I'd say, to me, success for an institution looks like when there are people, diverse people, kind of from top to bottom. And I think I'm not seeing that in the spaces that I work in.
Yeah, that is really interesting. So it kind of goes back to kind of realities of the people around you. And at some point, earlier in the conversation, you said that it feels like the hard work of pushing for that somehow always end up with the same group of people, like, or usual people who are involved in that when they were involved when it was inclusion, and then the diversity, and then inclusion, and then equity. I want to ask you about what is your experience in expanding that bubble, if you want to call it that way? Because part of the problem, it seems like, that institutions are reacting by outsourcing, but the real question is, like, what about in-house? Like, what about kind of like our own people getting better at this, like being more aware, being more kind of like attuned to this? Like, so.
Yeah, it's interesting. I mean, like I mentioned before, I'm ending a stint now as an interim, associate chair for EDI in our department. And so, I've been thinking about, like, quote unquote, what's my swan song? Like, what will I leave this department with as the more full-time person takes over in a couple of weeks? But it is about that engagement, right? Like, how do we move the needle on, like, the core group of people that are always going to do the work? And to me, it's a couple things. One is that I don't always think that our leaders create accountability for themselves. And I think sometimes accountability has this like really negative connotation, like, oh, you know, you're going to be held accountable. And I think it's more about like, you know, what are the specific actions and behaviors that our leaders are doing to advance this, rather than just speaking that they support it. And so actually tomorrow I'm giving a small little workshop to the division heads of our department to ask them to create accountability statements for themselves that they will make public, you know, next year in the year 2023. And it may seem simple, like, oh, they can write anything down and it doesn't mean anything. But the focus will really be on like, no, what are specific actions that you are going to take? Because a lot of times commitments to action, you know, are centered on values. And I think that's really good. You know, I think it's important to say that EDI is valued. But I think moving beyond that to say like, well, what are the actions that you as a division head are going to do, or you as the chair of the department, or you as the head of whatever are going to do. The other thing is, you know, as someone who's previously, you know, done some community-based work, and people who do this much more than me would probably agree, is that, you know, it used to be this mentality that, you know, this colonial mentality of like, well, we're going to go into a community and we're going to tell them what's best for them. And I think that's actually happening in academic institutions. This is a new thought I've had, where it's like, we do bring in these third-party consultants. We try to get quote unquote experts from outside the institution to come talk to us about this stuff. And we'll pay them thousands of dollars to do it. And we don't actually, but then when someone internally wants to do something and they ask for hundreds of dollars, they're like, I don't know. I don't know if we have the money. And you're like, but maybe they have a really great idea to how to move this forward that engages the larger, you know, community within this institution, that would be actually ironically more cost effective, you know, than bringing in this consultant. Basically, the idea is like, why don't we listen to the internal community the way we would when we're doing community medicine, you know, when we're practicing our academic medicine. I don't know if that makes sense, but it's this new thing I'm kind of thinking about a lot.
It makes a lot of sense, and you're not the first person to mention that, like how, you know, it's easy for an institution to think about and invest in outside resources, and then when you actually kind of like have people who are committed to certain actions and taking actions, like they struggle with getting the resources for even basic things. I wanna just double click on the accountability piece, because you're bringing a pretty like a radical idea here that, you know, the way I define accountability is it's the combination of kind of like responsibility that you have by the virtue of your position, and actually commitment to that responsibility. It's kind of like accountability is responsibility plus commitment, you know?
Yeah.
And I think it's really important because, as you said, accountability is something that people perceive like as somebody else is putting on you, versus you feel responsible and you want to make a commitment to actually push for change. So how do you see people react to that, like to that notion of, you know, asking for what are we willing to commit to, and be serious about this? And you know, do you feel like there are some pushbacks? And you mentioned that there might be a little bit. So I'm just curious about that.
Yeah, I think, you know, to me, I was actually really inspired by one of the early modules that we had in the Health Equity Scholars, you know, cohort, and that, you know, it was the story of self. And I really appreciated that module, because I actually think it's something that anybody should do, but even especially those of us that do work in DEI should actually intermittently do. I think it's important to like ask yourself, like, what is my why? Like, why do I do this? Because not that we forget, but I just think it's important to be able to easily, at a moment's notice, articulate it to others to inspire them to do something different. And so that is what I'm actually starting with this leadership group tomorrow when I give this little workshop, is actually just first starting to think of like, why is this important to you? Not why is this important? Again, not what are the values of our, but why is it important to you? Regardless of your identity, why is doing this work important? Because I think that's where the apprehension comes for the accountability, that they don't have anything to say, that maybe their identity is of a majority identity. Maybe they are a middle-aged white male and they feel like they can't speak to this. And I argue that they can. And I think if they think about it ahead of time and reflect on it and move forward with that, then I think they have something to offer. And I think that will in turn connect them with their constituents or their community or their employees or whatever you want to call it. Um, but there's so much, there's not so much, but there's often, yes, as you kind of alluded to there, I call it fragility, right? There's this fragility around like, I can't comment on this because I'm not Black or brown, or I don't know enough about this to say anything other than I agree with it. And I think that initially, gets you some, puts you in good graces, but then it's about what are you doing? And so I think then people are also afraid to like commit to something because, again, I think it comes back to resources and funding, and they don't want to say that they're committed to something that ultimately they know will cost money. And I think it's easy for me to say because I'm not in charge of budgets, but I think we've been so behind on issues of equity that it is going to be a quote unquote losing endeavor. You have to put in money. You have to put in time and resources because we're in a big deficit and we need to spend to get back to make change. And people want to make change, but don't necessarily want to spend. So
that is really interesting. And
yeah,
it's leading to my last question is, we know from working in activism that change requires sacrifice, as you were saying, like
yeah,
there's no change without, but also we know that, when you push for new and kind of like challenge the status quo, there's always a pushback. Like there's rarely, almost like that becomes like an indicator. If there's no reaction, then it doesn't seem like you're changing anything, because like
yeah.
generally people, when there is change, they feel, threatened by losses and kind of like, whatever is the reason for them. So if you were asked to think about like now, not just about your institution, but generally for this work, what is the big threat? Like what is it, that's something that you would say like is, at the horizons that we need to keep an eye on, that could be a challenge, for this work in the long term? What do you feel like is a threat to the work, or a pushback to this work?
Yeah, it's you know, yeah, I think it's like, one of my early mentors here at the institution, said this phrase to me. He's like, Dan, like change isn't hard. Like it's the process of change that's really hard. And we weren't even talking about equity versus inclusion, right? Like, so these really ingrained institutions, whether it's academic medicine, universities, corporations, like their ability to change is so stunted. And I think there's just like this weird, you mentioned before, like there's just an already innate resistance to change that I don't actually know where it actually comes from. And my bias is as somebody who I like new tech. I liked, I'm an early adopter of things like, oh, there's a new program, let's try it. In fact, that's probably too far sometimes on the other side where I'm changing for the sake of changing. And I have found that institutions are more measured, and so I think that's just a baseline threat. But I think the threat with specifically that happens in DEI work is that there are people in power that feel like their power will be diminished if equity is achieved, that it is some zero-sum game where another group, an underrepresented group's advancement will mean their decline. And I don't think it's always really conscious. I think there's a lot of subconscious, right? And people sometimes frame that as white supremacy culture, colonialization. You can call it what you want, and I have seen it happen where people get to a status level and they want to maintain it. And I don't know why equity would make someone feel that way. And I think that's the piece that, again, I don't have the answer right now, but how to have a real conversation with someone about like, if you do this, if you support it with funds, and it's not going to lead to your demise. In fact, it might actually lead to you, gaining greater status if that's something that's important to you, because if in lifting everyone up, you're also lifting yourself up. So, yeah, you can tell that I'm kind of struggling in trying to figure out like how to overcome that. That's just how my brain works. I'm always trying to think of the solution, but I don't think I have a solution on it. It's just more of something I've just noted as a threat to
Yeah,
your
it's
original
really
question.
interesting. It's almost like an invitation for people who are in this domain of kind of like activism and kind of like advocating for things, to think about like, what are the different people that in that space you need to manage, and how do you manage the realities that they experience in such a way that, as you were saying, because it is a mindset shift to move from seeing power as a zero-sum game to seeing power as a relational idea, which, for a lot of us in organizing, that's the idea. Like, power is relational. And if it's relational, that means that by building more relation, all of us could have more power. But if you think about it as a zero-sum game, then you think about, like, by kind of like, if I gain it, other people will lose it, or the other way around. And yeah, I think it's a really inspiring thought and provoking thought to ask, to people who are listening to this, to think about, like, what will it take to actually deal with that and create spaces where people can also experience the mindset shift about, what they think about power and how they think about it. So really, like, this was an amazing conversation. I know kind of like,
Sure.
there are a lot of things that we haven't talked about. Thank you for giving us a little overview and a perspective, what it takes to be and kind of like internal institutional activist, if you want to put it that way, in this space. And then also, like, I love the fact that it's not you're pointing and alluding that it's not like a 1-year project or a 2-year campaign. It's actually a lifelong journey, it seems like. So
Yeah, no, and again, maybe I should have prefaced everything with saying that, like, there's people that have different strategies for how they want to enact change in these large institutions. I think there's the mindset of, like, let's tear it all down and then we'll rebuild it in something that looks better. That's one way too. I think mine has always been of I'll kind of, get in there internally, be a mole, and influence from the inside out, and that has its challenges too. And I think it takes all different types of ways to change these institutions. So I'm also dependent on the other people that are kind of railing from the outside to kind of really change things, as opposed to working from the inside. So
that's great. Well, once again, thank you for an amazing conversation, and
yeah,
good to have you here.
yeah, thank you.